topically, you can reduce the risk of ovarian cancer about 96%. And the good news is that it also seems to have an impact on the risk of breast cancer in those women who do this at a young age. So young is under 40 or under 45. We do not recommend removing the ovaries before women have children. We're not making women barren with this. We're not saying you can't have children. So it's not like if a 27-year-old comes in and finds out she has the gene, now she has to either rush and have babies or not have children at all. Not at all. That's not the fact. The data is that ovarian cancer still occurs a bit later, and for the most part, it's perfectly reasonable to wait to do this prophylactic surgery until the woman's closer to 40. And it has a 96% protection as an estimate from this minor surgical procedure. We also do surveillance on women who, meaning we're looking for them, which involve these tests if they carry the gene and they aren't yet ready to have their ovaries removed, but not a totally sufficient thing to do. Now, I will mention that prophylactic mastectomy is a very effective way to prevent breast cancer. 90 to 95% reduction. Reconstruction is done at the same time. This is really a peace of mind choice for some women, although there are some individual situations where it really makes sense. I mean, I had recently a woman who actually had a lymphoma in her 30s that she had to fight very hard and had to do bone marrow transplant for. And then when she turned 38, it became clear that she had a gene unrelated to her lymphoma. Well, this woman cannot face chemotherapy again. And so she made the decision to do prophylactic surgery simply because if she were to get breast cancer, she would have to limit her treatment, and she decided not to take that chance. But for most women, they're comfortable and they have peace of mind that the follow-up that we're doing is reasonable. So I really tell people we're not doing this test so that we can tell you you have to have your breasts off. Yes, it's an option, and I think everyone should weigh the pros and cons, but there are alternatives, and we already talked about some of them. This is really what we're talking about. This is the article. Some women are choosing surgery, but that surgery should be oophorectomy. But the options for surveillance for genetic testing now, when we have a gene, is MRI, mammogram, breast exam, and I think you'll see there's some specialized digital three-dimensional ultrasound that's coming out that may be part of this also in the future. Okay, so here's my goal. Here's what I think is true, because I talk to an awful lot of patients, lots of individuals, after, before, whatever. We need to educate our community. The fact of the matter is this is something, and we're going to look at it in one more second about this, is something that can have an impact. It can have a life-saving impact. But this is not just interesting. This is not just another thing to label people. This is an opportunity, but people don't know about it, and people who are at risk really have no idea. We need to find people who are appropriate for testing. It isn't a profoundly expensive test when we're having to look at just the 3 sites. So the 3 sites, you know, that are for the Ashkenazi population, that costs about $380 to $400. When you have to do the full sequence for the non-Ashkenazi population, that runs close to $3,000. That's a little bit different. But still, I do meet people from time to time who simply do not test because they can't even really afford that copay. But the bottom line is we're trying to prevent avoidable deaths and suffering. Why test? The truth is the biggest reason, even though breast cancer is most common, is to prevent ovarian cancer. 50% of ovarian cancer that occurs in young women who are Jewish is due to this gene.